Hi, my name's Warren Gavin, and I'm a medical doctor and a hospitalist here at Methodist Hospital.
My name is MYRA Whitaker, and I'm a staff chaplain here at Methodist Hospital.
My name is Jody White, and I'm a respiratory therapist at Methodist Hospital, downtown Indianapolis.
My name is BRANDIE KOPSAS-KINGSLEY, and I am a shift coordinator at University Hospital for the Medical Intensive Care and Rapid Response teams.
Last night on WRTV News at 11, Central Indiana healthcare workers shared the tumultuous journey the coronavirus pandemic has been for them at the hospital. Tonight, they share with us the emotional toll of the pandemic and, while fatigued, how they find hope to keep fighting.
How would you describe this year?
Oh, chaos. Frightening. Unpredictable. I don't like unpredictable, so it's been very scary. In hopes that it gets better. I can't believe it's lasted this long.
I think when you go into healthcare, you sign up for anything, right? Because like when we study medicine, you always learn about pandemics throughout history, and nobody could have expected this.
The numbers we see every day are people who healthcare workers across Central Indiana have fought to save.
It's been difficult, and it just stops you in your tracks. How many patients we've lost, and so how do we cope with that? You know, I'm not sure.
Rising coronavirus deaths are a harsh reality that thousands of families are experiencing, and a daily struggle for medical professionals and hospital staffs.
What made you say yes to that call?
Because I know a lot of people don't want to do it. And I'm very capable of doing it. And I wanted to help these people that don't have the help that they may have needed. So there was many of us that was like, and I was one of them, was like, okay, I got this. This is what we're going to do. This is what needs to be done. This is my job. Like, this is what I need to do.
Pushed to their limits with no reprieve in sight.
Like, we keep having these surges because people are, you know, relaxing and like, oh, it's fine. Wear your mask, they're with your friends. You know, have hand sanitizer locally so you can wash your hands regularly. It's simple as that, and people just aren't understanding it, and it's frustrating. It frustrates me.
We've all been stressed, and we're putting in more hours, and we're really learning what our limits are. Personally, professionally, education-wise, what physically our bodies can handle, and then for people to not wear masks or to fight the social distancing, or to say it's a political issue. You know, your life is not a political issue to me. I'm going to come in every shift, and I'm going to treat you like you're my family, and I'm going to give you the best care I can. And so that's really hard.
Their fight against COVID does not end when they leave work, making their career sacrifices a sacrifice for the whole family.
I have a mother that lives with me. She's 87 years old, so I'm concerned about taking something home to my mother.
We really, all of us, sat down as a family and decided, you know, what am I going to do? They've seen me gone for longer than usual during all of this. And so I think they also connect that mommy's gone because she has to take care of others with this.
You make your way to the basement and try and do what I call decontamination, you know, after coming home. And even that part is a little bit difficult because you have a little 5-year-old girl who's there waiting to put her arms around you and hug you, and she's got to wait an extra half hour. And so, you know, all those things have been difficult, but we've kind of worked together.
The time they get with their families made bittersweet by what they've seen other Hoosier families go through.
Having to watch the doctor or the nurse take an iPad in with the family so they could say goodbye. That was horrible.
This patient is going to die. Yes, they just got sick a couple days ago, but now you have to realize that they're not coming home. That is an empty chair at Thanksgiving. That is a person that will no longer have memories with you anymore, and I think that's the hard thing.
And these heroes admit fatigue is setting in as the number of cases rise.
In the beginning, it was, oh, we love our healthcare workers, and, you know, sending meals to the hospitals and having these, you know, the prayer trains they've been having. And you can't be that person and then also not wear a mask, because we're still fighting, and the numbers are rising, and the hospital admissions are rising, and the deaths are rising. And anything that we can do as a community to help each other is just gonna help everybody.
But hope is what keeps them going, and knowing that their work is helping people return to their loved ones.
They understand that now they can go through a lot, they can conquer a lot, they can come through a lot, so that even though a lot of them may have had other health issues, it's not the end. They still recover and they go on and have a good life.
With this, it's really shown us what we're capable of and what we can adapt to.
I, like everyone else, hang on to the idea that there will be an end at some point, and that my family stayed safe, and that the majority of patients are doing well.
And it's not hard to see how much this has taken a toll on our healthcare workers. We can help them help us. When I spoke with each of them, they all shared the call to action for all of us to simply wear our masks, wash our hands, and keep some social distance. It's not a very big ask when you see everything they are doing for us.